Hi, thanks for joining us again today. I want to talk to you today about an area that is more for the female crowd, for women obviously. And it has to do with a situation or a disease state, if you will, polycystic ovarian syndrome. Let me try to typify this for you. Cystic ovaries, string of pearls appearance on the ovaries. That's the outward, if you will, manifestation. What I want to deal with is why it's so common today. It's probably been 70 years plus, who knows, first diagnosis of PCOS, polycystic ovarian syndrome. What does that mean to you? Women that have dysfunctional cycles, women that are not ovulating, they're amenorrheic, they don't have a period, they tend to then gain weight into the midsection, there's more adipose or fat tissue into the middle. They have characteristic scenarios such as increased facial hair, increased body hair. We would term, and I'll explain this, insulin resistance. Elevated testosterone levels become a typical manifestation. And how this is treated in the traditional medical community today is simply to utilize, in many cases, things such as birth control pills to attempt to suppress ovarian production of estrogens and ovarian production of testosterone. I don't know that gets at the root. If you were to ask me, well, what is the root? I don't really know what the root problem is. No one really knows. There are some components and areas that believe that there might be some genetic defects having to do with insulin receptor activity, sex hormone binding globulin receptors, all very technical jargon and stuff, which I don't think does much to help in a practical sense folks deal with the characteristic scenarios such as not ovulating, dysfunctional cycles, not having a period. Go to the OB-GYN, you have cysts on your ovaries, your testosterone's elevated, you're gaining weight into the midsection, this whole cascade, facial hair, this whole cascade of scenarios. You can't lose weight, you're having difficulty losing weight. So this is not a one-shot approach or answer, such as, well, let me just put you on birth control pills. I don't know that deals with the heart or the root. I think to get closer to dealing with the heart of the root is approaching it more from a naturopathic concept. Number one, let's look at what's going on. More weight, high testosterone, sometimes elevated estrogen, low progesterone, increased facial hair, all the things we talked about. How do we deal with that? What's a more practical approach? Just shutting down the ovaries production, I don't know, is the answer. If you really look at more interventional, more functional approaches, it has to center around weight loss. And that's easier said than done. How do I just lose weight? Well, I think there's a couple of ways. We have to understand that a low glycemic load diet is important. If you've watched any of the previous videos, you'll find that we talk a lot about a higher fiber, low glycemic load diet. If you're consuming, as a woman, you're 18, 19, 20, 25, 27, and you're consuming a lot of sugar, a lot of white refined sugars, a lot of carbohydrates, crackers, pastas, pretzels, and you're kind of shy on vegetables and very fibrous types of vegetables, that's going to pose a problem. Because what that's going to encourage, I'm going to get a little more to the root of this, that's going to encourage possibly increasing blood sugars, correspondingly increased insulin levels, which unfortunately can be stimulatory to the ovaries, which causes an inordinate rise in testosterone, possibly then even linking to a rise in estrogen and a drop in progesterone. Now, there are some literature pieces that will tell you that elevated testosterone is the key component to this, and that's where the root is. And I couldn't tell you that I could tell you for sure that that's not necessarily true. My devil's advocate position is always, oh, how does a woman just develop out of the blue in the last 20 years a skyrocketing level of women that are without ovulation, dysfunctional cycles, weight gain in through the middle, rising testosterone levels, increased facial and body hair. What is all this stuff? How does this just occur? Well, I think first of all there are a lot of environmental issues, and I'll get back to the approach. and I do think components, chemicals such as bisphenol A have been linked, by the way. Plasticizers. We consume a lot of foods and beverages, etc. that are in plastic-containing products. I think that needs to be limited. There's a lot of literature, and I'm not an environmentalist, but there's a lot of literature pieces that document that bisphenol A is an endocrine or a hormone disruptor. It interferes with normal physiologic production of your hormones, male and certainly female. I think there may even be a link to a lot of environmental fake estrogens and fake hormone or xenoestrogen components that even relate to why we have so many young girls and young boys developing physiologically at such young ages. They're developing feminine characteristic, breast, body hair, etc. at 8 years of age, 9 years of age, precocious puberty. I don't know that we just catch these things. Our genes are bad. If that's the case, then our whole gene pool, commensurately, statistical analysis does not support that. We have rising rates of these scenarios with a relatively stagnant population and rising rates of these difficulties. So let's get more into the meat of this. How do we deal with it? First of all, just shutting down your cycles and your ovarian production is not, in my opinion, the answer. Let's get more practical. We've got to lose weight. If there's a weight issue with you, we've got to get you to lose some weight. How do we do that? A low glycemic load diet, a diet that is focused on a tremendous amount of fiber, more vegetables, lean proteins, more organic meats when and where possible, more fish, organic chicken, non-hormone injected beefs, which is a problem today. Get rid of dairy as much as you can. It should be eliminated from your diet. We've got to get you physically active. Well, I don't have time. I work. I'm busy. I'm in school. So am I. I'm busy too. You're busy. Everybody's busy. We've got to understand the key role that physical activity has in this, because what it will do is increase insulin receptor sensitivity and efficiency, which indirectly then, I don't want to get technical, but affects sex hormone binding globulins, can affect testosterone levels. Exercise, if you just lost 10 pounds, has a huge impact on ovarian production of these hormones, insulin receptor sensitivity. And I know some of these terms are not kind of maybe in the vein of what you're thinking. You're looking for a quick fix, or what can I take? Well, I'm going to tell you that it starts with weight loss, fat loss in particular, not lean muscle mass. Building your lean muscle mass, losing fat, you'll improve insulin receptor activity. You will stop aggravating the ovaries. You will reduce testosterone levels. Number 2, flaxseed. Let's get some flaxseed into your diet. Organic flax, not the liquids, flaxseed. Let's get on to some high doses. We use a quality form, molecular distilled omega-3 800s. We use a standardized European journal, European extract of Agnus castus, Vitex, has a balancing effect on hormones. There's literature that shows a prep called N-acetylcysteine used at 1.8 grams to up to 2,400 milligrams or 2.4 grams a day can drop free androgen index, which is free testosterone levels, and total testosterone levels significantly. N-acetylcysteine. D-chiroinositol, a specific nutrient that was written up in a New England Journal of Medicine about 10 years ago about its effectiveness in improving insulin receptor activity. This is a complex issue. If you haven't gathered that already, this is not like, let me just take birth control pills. I think we've got to look at it from a weight, dietary, how about lifestyle modification, and then numerous specific nutrients that can help you. Vitamin D levels are critical. Vitamin D levels are documented to be linked to an increased rate of polycystic ovarian disorder. When we raise vitamin D levels, there's a reduction in polycystic ovarian syndrome. And I think as much as you can, from a chemical exposure standpoint, eating organic fruits and vegetables whenever possible, cleaning and washing vegetables correctly, reducing the amount of bisphenol A in plastic and plastic-containing preps, all works to your good. Very complicated subject. I do believe there's answers. If you suffer from this area, have a family member, know that you do have some more naturopathic and holistic options. Thanks for tuning in. Stay tuned.